Welcome to another episode of Answers for Families. I'm your host, Dr. Tommy Martin. I'm a combined internal medicine and pediatrics attending, and I work in the PIMQ at Boston Children's Hospital. And today I am so excited to talk about something that is super passionate to my heart, and that would be childhood obesity. And I have two incredible panelists here with me today. I have Stephen Coletti and Dr. Margaret Stefater-Richards. Thank you guys so much for joining.
Absolutely. Thank you for having us.
Guys, this is I think a very hard topic to talk about, but also one that is extremely important. Before we get started, could you guys just introduce yourself a little bit and tell our listeners what exactly you guys do at Boston Children's Hospital?
Sure. I'm Margaret Stefater-Richards. I'm an endocrinologist here at Children's, and I specialize in talking to kids and families about weight and metabolic related issues.
Yeah, I'm Stephen Coletti. I'm a clinical social worker in endocrinology. I work in a few different programs, our type 2 diabetes program, our Empower program, and the Optimal Wellness for Life program. So I'm in a different areas, but I'm often working with patients where maybe they're living in larger bodies and that there's a lot of stigma around that, and working with them and understanding the whole patient and the whole family is really important in my role.
That's incredible. It sounds like you both have a lot of hats and you guys probably stay very busy.
Yes.
Very much so. Well, fantastic. Well, I cannot thank you guys enough for being here with me today to talk about this very important topic. So the first thing, I think we should just discuss, what is obesity? Like, how do we define that?
Yeah, that's a great question. So technically, obesity is defined by certain levels of what we call body mass index, or BMI. That's how weight compares to height. But really, we know that people are so much more than a number. And so when patients come to clinic, we look not only at that number, but at markers of metabolism and metabolic health as well.
Yeah, and with this, so I know that you said certain numbers necessarily like within their BMI. How do we look at that in children? I know in adults, like we have certain numbers based upon just their BMI, but in children, it's a little bit different, right?
Yeah. I mean, if you think about kids, their body proportions are changing throughout their childhood, and that is completely normal. So what we look at is how a child's BMI compares to other children, so or to a sort of standards for growth. And so we look at a body mass index of the 95th percentile as being sort of that cutoff, is where we start to look a little bit more closely at metabolism.
Okay, fantastic. And if a parent has a child that may be in that higher percentile for maybe weight but not necessarily height, is that something that parents should be worried about, concerned about, or how do you talk to parents about that?
Yeah, and I think first of all, normalizing that bodies come in all shapes and sizes. Yeah. There are people who are shorter than others. There are people who are taller than others. There are people who weigh more than others. And to take away the sort of good and bad label, I think, is really important for families and in the medical setting as well. Really, we're mostly looking at how weight compares to height, but also simultaneously looking at the pattern. How has a child been growing in terms of their height? Has that stalled, and is that the reason for this, or is it primarily that that weight has dramatically changed a lot over a period of time, and what else has been going on in the person's life or medical history that may have contributed to that?
Yeah, I love that. Just that there's so much more than just that number. Like, these children are more than that number, that BMI number. And it sounds like you guys are taking a very holistic approach, looking at everything that could be, playing into the roles of that number. Another aspect would be, you had mentioned, you look at the height and the weight. If they're both in the 99th percentile, they could just be a big kid.
Exactly.
Yeah.
Exactly.
Okay, fantastic. And then, with obesity, there's a lot of stigma, a lot of misinformation about obesity. And what would be some things that, I guess, some stigmas that you hear, some maybe true or some myths that you hear about obesity? And then the last part is it considered an eating disorder? Because I hear that quite often as well.
Yeah, I could say a little bit about that. I think just by nature of living in a larger body, just from my conversations with patients, and most people probably have observed this themselves, is that you're going to be more susceptible to weight stigma and bias just in the world we live in. And, I think we often, or people often will moralize about obesity, right? Like you were saying, just, what is, you didn't say this, but like what people are often making judgments about bodies, about eating behaviors, right? What's good, what's unhealthy, what's healthy. And, that becomes internalized over time for people. And in fact, kids as early as 3 are already, developing beliefs about their weight. One study I was reading recently is, girls as young as 6 years old are already have a preference for thinness over other body weights. And so we get these messages everywhere from family, from just social media, right? And when they become internalized, then there's this belief that my body is unacceptable, right? And, people will do, as human beings, will do whatever we can to feel accepted and that we belong. So sometimes that does lead to disordered eating. I think there's a lot of misconceptions about it where it's just talking about food or talking about bodies leads to eating disorders. It's a little bit more complex than that. So it's really just looking out for, concerning behaviors, whether that's like a preoccupation with food or dieting or weight loss, or, excessive exercise, and maybe hiding food or hiding behaviors around food. Those are things that you might notice. Again, sometimes these are things that you don't notice, and you might just have to be more aware of like changes in mood or changes in, just distress around food and eating. And that's, as opposed to talking about weight, you're talking about your concerns about your child's well-being overall.
Yeah, I think those are some really, really important topics and points that you talked about. And so what I gathered from that is you're saying like obesity itself is not necessarily an eating disorder, but because of the stigma and the kind of judgment that we get from the world, it can lead to those behaviors and maybe some of those aspects of an eating disorder. Is that correct?
Yeah, absolutely. And I think every person is different and their history is different. Like we know with eating disorders, a family history of eating disorders, you're more likely to develop one. So if the foundation is there, it's more likely. So, but if you have a good relationship with your child and they feel supported and they feel, regardless of their body size, they're welcome, they're going to be protected from that. Now, not always, because we live in a world where there's a lot of judgment around food and bodies. But I think that relationship and that safety and that relationship is a huge protective factor.
Yeah, for sure. And so I know that another one of our podcasts, the Parent Cast, talked about eating disorders in general, but I wanted to ask you guys, so you had mentioned some of the signs to be looking for, but I think it could be challenging. Like if we have a student who's an insane athlete and they're working out all the time and they're trying to eat healthy, how do you guys kind of tease out, are they developing these bad disordered eating habits, or are they just trying to be the best athlete they could be in high school?
It's a great point. It's really hard sometimes because there's so much shame and stigma around eating disorders and weight and many other things. So I think we have to reduce the stigma in general in healthcare and all realms really, because people need to feel safe to talk about what they're struggling with, right? And if they don't, then they'll hide it, like you're saying, right? They'll do whatever they can to appear quote unquote normal, and that, so I think as long as we're having these conversations like we are and, reducing the stigma, then more likely kids are going to want to talk to us about what's going on for them.
Yeah, I think that is so important because I think, as you're mentioning, I think especially children that may be living in a larger body, they may feel like they can't talk to anybody about it or that they're alone on this journey. I know personally, I grew up very overweight and I felt very judged and very stigmatized, and it led to bad thoughts about my body. And so just for like the other parents and children that are out there, know that you're not alone and you do not have to be alone on this journey. And there are millions upon millions of people who struggle with their weight and may be living in a larger body.
Absolutely. Yeah. And I think that is that loneliness, right? That that we internalize the beliefs about ourselves, about what's acceptable, what isn't. and because we don't feel welcome, right? And so that's going to lead to that loneliness, and we would obviously want someone who's feeling that way to ask for help, but that might be really hard for that person has asked for help in the past and wasn't able to get it. So yeah, I think that's a really important message to be sending people.
Yeah, and we're talking about this episode all about childhood obesity, and I think you guys would agree with this. And something that the parents and children should know is that your worth and your child's worth is not determined by that BMI number. It's not determined by the weight on the scale. It's not determined by the size of your jeans or your pants. It's not determined by your size. Correct?
Right.
Yeah.
Absolutely.
Absolutely.
So knowing that obesity could be a hard topic to talk about, extremely hard, and we don't want our children to feel judged. We don't want them to feel like that we are stigmatizing them on top of what the world's already doing. How do you guys recommend approaching this conversation with our children if their pediatrician says their BMI is in the 95th percentile and their height is in the 50th?
Oh yeah, I can
Since
say a little bit.
before, and then I can add.
Sure. Yeah, I think, again, as parents, you have a really tough job, and having that conversation is probably going to bring up a lot for you, right? And I think what's important to mention is we all probably have some stuff around food and bodies. I don't think anyone in the world exists without having something about judgments or criticisms about themselves, right? So I always suggest that parents just check in with themselves and have some self-compassion around this conversation, and even to see if there's anything around bodies and food about themselves that they haven't really looked at or maybe have pushed down and don't want to look at. But I think we bring that to the conversations we have with our kids because we all have bias. So I think, and there's nothing to be ashamed about having bias, but it's an invitation to look at that, right? And to see, am I going to bring any judgment that I've experienced maybe as a kid about my body to this conversation with my child? Of course, nobody wants to do that, but unless we're curious about it, that might happen. So I think it's really important to just make sure you're ready for that conversation, and maybe you just need a little more support or time before you can do that. But it's also okay if you make a mistake, because you always have that opportunity for repair, which is a beautiful thing, right? Like that corrective experience with your kid makes a huge difference. And so that would be my first piece of advice.
Yeah, and I think these conversations are hard. In the medical setting, we try to ask permission to speak about weight. And I always try to, as we were talking about before, really only talk about weight in the context of overall growth. I think this helps to send the message that we're really looking at growth as a whole, and also in order to send the message that we're really interested in health and how a patient feels and how they experience life, as well as their risk factors for future disease. I really try to focus also on symptoms and other things that may play into that overall picture.
Yeah, I think that's super helpful. I'm sure the parents would really appreciate that advice. And even if we do our best and we try to approach it with compassion, and it could still land wrong, right? And so when it lands wrong, or maybe they're getting made fun of at school and feel embarrassed about their size, how can we help children feel confident in their body when they're constantly being judged about it?
Yeah, that is also very hard because, I can also see a parent, and I've heard this before from parents, even colleagues I work with, where nobody wants to see a kid suffering, right? No one wants to hear that a kid's being bullied for their weight or feels embarrassed by their weight. But I think sometimes, with all intentions being good, we might even go to the idea that, well, maybe if this child lost a few pounds, they wouldn't be bullied anymore. I've heard that. Yeah. And I get that, but at the same time, yes, how is that going to land, right? And what really, I think, a kid that feels embarrassed about their weight or is being bullied is really just needs to be heard and listened to about their experience, and for you to empathize with them and have compassion for what they've been through, because some kids have been being bullied for months or years, and the impact that has on their mental health and well-being, right? And to just be with that and not feel like you have to fix it in that moment. Because kids will appreciate you just being there. And I think that's probably the first thing I would do. And that's not to say you never talk about their weight or their health, but to start there, because that's probably what your child needs in that moment.
Yeah, that is so helpful. I know a lot of children struggle with this, and something that you guys are the experts, so you could let me know if you think this is good advice, but something that helped me a lot when I was going through getting made fun of is for people to encourage me about what my body can do and not what it looks like or the size of it. And so even though I may have been overweight, I was really good at football. And so knowing that my body was helping me to be good at football. And then one of my favorite Olympians, I hope I do not say her name wrong, but Ilona Mayer, she talked about how her BMI is higher, and yet she's an Olympic athlete. And so I think giving just such good reassurance that your body's not, like, the worth of your body's not determined by the size of it, and we should be proud of what our body can do regardless of what size it is.
Absolutely.
Yeah, I think one thing I'll add to that is, I think there's a lot of push, might not be the right word, but in social media of body positivity, which I've learned a lot about that, like over the last couple of years, and other movements about just loving one's body, appreciating one's body. But there's a lot of different ways of looking at that. And I think what I find is that we often just want to tell people to love their bodies, right? But there might be a part of them that just does not, right? And I think it's understandable for people to want someone to just have a good relationship with their body and with food in general. But that can take a lot of time and also just exploration of, like one's past and what messages they got from an early age. And I think it's really important to explore that as opposed to just jumping to this sort of you should just love your body kind of belief. And I get where that comes from. There's a lot of pain around what people have experienced in terms of discrimination and bias from other people. But I think jumping to the conclusion that one should just love their body is much harder. It's much easier said than done.
Yeah, I think that's so helpful. I know that the children that are being bullied, those words and the actions that people take when they're bullying for their weight, even a sorry doesn't make it go away. Like, it doesn't make them magically forget about it. And these are things that they may hold into their teen years, into their 20s, into their 30s. I know there's times that I still struggle with it, and so I think that is so valuable about what you said is just because you tell someone to love your body and give them affirmations doesn't mean it's just a light switch and then it's fixed.
Yeah, I mean, these things can be traumatic, right?
Yeah.
Right, depending on how it impacted your body, like trauma lives in your body. And, you might have to do a lot of work with that and get support from others around that before you, and yes, the hope and the goal is for someone to have a better relationship with their body, but the world we live in makes that hard.
It
right?
definitely does.
Sorry. I think on a related note, it can be very helpful actually to separate bodies from food, at least in a negative way. And what I mean by that is instead of talking about changing your diet in order to change your body in terms of eating less to have less weight, talking about eating to fuel the amazing things about your body. I talk to my kids about eating your vegetables and your protein to help your muscles, to help you run faster in soccer, and how to help your body grow. And I think that can be a way of helping to address some of that stigma. I find many kids who come to clinic might be afraid to eat in front of other children, afraid to have school lunch, afraid to eat the unhealthy foods at birthday parties because of the way that might be perceived by others who are bullying them. And I think as much as we can reinforce the separation of those things, the easier it will be for patients to accept those things about their bodies.
Yeah, that's extremely helpful. And so with the talk about weight, and let's say that we have a child that is coming to you guys saying that they want to lose weight. What are like the options, medications, what do you guys recommend, or how do you talk to children about that? Because I know on social media, I'm sure they're going to see about weight loss medications, and I'm sure they bring questions up to you guys.
Absolutely. So, I mean, there's really no one size fits all, and we approach each patient individually. And I would say that, it's really important to pursue these things in the context of either your pediatrician's office or a specialist's office, rather than on your own or in a non-medical setting.
What your friends say at recess. Or
and so, we talk to patients. We always talk about the fundamental aspect is really seeing your medical team and a registered dietitian on a very frequent basis in order to talk about what medical aspects might be going on, to make sure we're not missing an underlying cause, to make sure that we're not missing a health problem that could be related, and also to make sure that we're sending the right dietary messages and helping families, because feeding your kids is not easy. I can speak from experience. I think, beyond that, we talk about other options that we have, and anti-obesity medications are one of those, weight management medications. This is medications like Wegovy, Saxenda. You may have heard of Ozempic. That's kind of Wegovy's sister medication for weight, per se. We also have oral medications for people who don't want to do injections or whose insurance may not pay for that, because unfortunately, that's an issue. We have phentermine, topiramate, Qsymia. So we have a lot of options, and we really work with families and kids to talk about what aligns with your goals, with your medical profile, with what you're sort of able and willing to do on a daily or weekly basis, and consider all of those things. We do require that patients who are on medications are seeing us quite frequently, because we don't want to miss out on seeing important side effects that can arise with any medication.
Yeah. And with the management part of it that we're talking about, I know that you guys are specialists in this, and from what I hear, we have a pretty incredible program at Boston Children's Hospital. Could you tell us about that program, the name, and then kind of the things that you were just talking about that you guys offer to help families? Yeah,
so in the Empower program, we offer frequent medical visits. Usually they're about on a quarterly basis, and we also expect that patients are engaging with a nutritionist or a dietitian. We also offer mental health support and mental health screening. And we offer, through the OWL program, which is a tier within our program, the really specialized behavioral health counseling. This is with psychologists who are really specialized in talking to kids around these issues. And so we offer a program with sequential visits with these individuals in conjunction with nutrition visits. We also offer, we know that life is crazy for families, and it's not always possible to get here, even to one of our satellites. So we do offer some virtual visits, and including some group like cooking classes and other things that we hope make this a little bit more accessible for families.
Yeah, and cooking classes, I think that'd be a lot of fun, like especially if the families could do that together with the children, teaching those habits at a young age, and then, growing up learning how to cook whole healthy food meals.
Yeah,
I think that'd be great.
We want eating healthy to be fun and enjoyable. Like I tell patients, like I want you to like eating, right? Like I'm not going to tell you to eat things you don't like, right? So.
Right. Am I allowed to come to these cooking classes?
Yeah, for sure. Come along.
Fantastic. That'd be a lot of fun. So something else that I think you guys offer, and actually you're an endocrinologist, correct? And so, I think previously we're just like, decades ago, weight is just like, eat less, move more. That's all there is to it. But there's a lot more to it. So what's the role of an endocrinologist in terms of like the Empower program?
Yeah, so I think there's been a lot of misconceptions about weight, that it's just this seesaw of like what you eat and what you burn. But we know it's a lot more complicated than that. And really, weight is regulated by our brain and our hormonal system in the same way that everything else, like thyroid, growth hormone, anything else. It's actually probably a bit more complex based on the science, which makes it makes sense that it can be hard, that many people are affected by overweight and obesity because it's very complex. And we know that, for example, some of these medications can help to target those hormonal systems that might make it harder for people to lose weight.
Fantastic. And I think, one question I was going to ask you, and I think you alluded it to there, what is one way that Boston Children's and the Empower program stand out, across the nation?
That's a great question. And I think we are lucky in Massachusetts to have had fairly early coverage for weight management medications, although it's not perfect. And that has allowed us to sort of become early adopters of using some of these medications, especially in children. And I'm excited for the future because I think that we will only have more options and more information about the ways that we can use these medications.
Yeah, I couldn't agree more. I think we'll have more options, more oral options, not instead of just injectables. I think we're just at the at the start of what we're going to find out about obesity in general and how we could manage it and help people. So if families wanted to get in touch with the Empower program, what's the best way to reach out to you guys or to have their kiddos seen?
Yeah, so basically you can reach out to the Department of Endocrinology or have your pediatrician send over a referral. We also have a website that you can check out, and we have our information there.
Okay, fantastic.
Yeah.
So before we end today's session, our incredible parents, they send in a lot of questions. And so we have a couple questions that I was just going to ask before we end the show. So this one is Ozempic safe for teenagers? What would be some of these short and long-term side effects?
Yeah. So Ozempic and its kind of sister medication for weight, Wegovy. These are the same generic compound, packaged differently. Ozempic is packaged for diabetes. Wegovy is packaged for weight. They're both FDA approved in kids ages 12 and up. And that means that there have been careful, randomized, controlled studies with placebo done in kids ages 12 and up. Those studies suggest that these are pretty safe medications. That doesn't mean that they're free from side effects, but in the context of close medical care, for many patients, they can be very safe, which means, the expected benefit outweighs any risk.
Yeah, and I agree completely. What would be some of maybe the side effects that they should alert their doctor about and say, hey, my child's experiencing this?
Sure. Yeah, the most common thing is a little bit of gastrointestinal upset. So like feeling a little nauseous, just kind of feeling a little not good in the tummy, but for most patients, those are manageable. For patients who are having vomiting with the medications or feeling so sick that they're not able to eat, we really want to know about that sooner rather than later.
Okay, fantastic. And then we have another question. So are there underlying conditions in adolescents that cause rapid weight gain, but are not just related to diet and exercise habits?
Yeah, absolutely. And the part we didn't talk about was that, our brains help to regulate how hungry we are, but also our brain and other parts of our body, including fat, which is an organ system, believe it or not, controls how much energy we burn. And there's several diseases that can influence both our level of hunger and how much energy we burn, in addition to other parts of that complex hormone system. And so part of the endocrine evaluation and the role of an endocrinologist is to really look carefully for signs that can sometimes be very subtle, that there might be an underlying disease.
Okay, fantastic. That was extremely helpful. And so, guys, I cannot thank you enough for being here for today's session. I think talking about childhood obesity can be very challenging. I think you guys package this in a way that's very easily understood, and I cannot thank you guys enough for coming. So if any families out there want to check out the Empower program, they do not only offer services that will help with lifestyle modifications and changes, such as cooking classes, which we talked about, which you guys may see me at one of them, talking about exercise habits, and then, of course, if needed, weight management with weight loss medications as well. Well, guys, I cannot thank you enough. Thank you again for being here today. Thank you guys so much for watching this episode on Answers for Family on Childhood Obesity. If you guys want to stay closer in touch, make sure to check out our Boston Children's social media channels, our websites, our YouTube channel. And there was recently some episodes on healthy eating habits and weight loss medications that you do not want to miss. These are on the Answers Parent Cast. Until next time, this is Answers for Families. Thank you guys so much.